Hey guys, it's Hikaru here, and today I'll be explaining about the fractures to the lumbar vertebrae using the slides that I've created here with Canva, and also I'll be using this website called Biodigital for some visual analysis. This website here is extremely helpful for anyone who studies involves the anatomy of the human body, so I completely recommend this website. Now, let's begin. Before we start to discuss about the fractures, let's first look at the anatomy of the spine. So here we have a diagram that shows the backbone from different views. Here we have the anterior view, here we have the left lateral view, and finally we have the posterior view. The first two vertebral columns is the atlas C1 and the axis C2. Now these vertebral columns belongs to the cervical vertebrae, which are labeled from C1 up to C7. Now below it we have the thoracic vertebrae, which consists of 12 vertebral columns labeled from T1 up to T12. And finally, we have the lumbar vertebrae right here, which consists of 5 vertebral columns labeled from L1 to L5. Now right below the lumbar vertebrae, we have the sacrum right here, and below it we have the tailbone, which has the scientific name of coccyx. Let's further discuss the lumbar vertebrae. This portion of the spine is the thickest region and it is located in our lower back. The reason for it being the thickest part is to support our body's weight and also to keep our bodies upright. The other functions of the lumbar vertebrae includes the protection of the spinal cord, which carries information to and from our brain. It absorbs external shock through the intervertebral disc, and it also is an attachment point for the back muscles. So, what exactly is a fracture? A fracture is a break in the bone or cartilage. Although it is usually a result of trauma, a fracture can also be a result of an acquired disease of the bone, such as osteoporosis. Osteoporosis is a medical condition in which the bones have become brittle and fragile from the loss of tissue, typically as a result of hormonal changes or deficiency of calcium or vitamin D. Here you can see the huge difference between a normal healthy bone and a bone that has been damaged by osteoporosis. I have obtained these definitions from medicalnet.com. Here are some of the causes of a fractured lumbar vertebrae. Car or motorcycle crash, fall from a height, sports-related accident, violent act such as a gunshot wound, and bone insufficiency such as osteoporosis and tumors. These are the symptoms when you suffer from a lumbar fracture. One will suffer from severe back pain that worsens over time. If the injury involves a damage to the spinal cord, the patient might feel numbness, a tingling sensation, or even weakness of the limbs. If one experiences a high-energy trauma, the victim could not only fracture his vertebrae, but could suffer from a brain injury which causes the victim to lose consciousness. If you're ever in a situation where you have to help someone that's experiencing a fractured vertebrae due to a trauma, whatever you do not move his body. Call the medics to carefully lift the victim into the ambulance. This is because any broken fragments of the vertebrae can easily damage the spinal cord through movements. Once the victim of the trauma is sent to the hospital, the doctors will perform several tests in order to diagnose a fractured vertebrae. These tests include an X-ray of the spine, a CT scan to check the stability of the bones, an MRI scan to check if there are any damages to the nerves, a bone scan to determine the age of the fracture. This is usually used to diagnose osteoporosis. And finally, a neurological exam is tested on the victim by studying his or her reflexes. In order for doctors to figure out a recovery plan for the patient, fractures are classified into 3 fracture patterns that consist of flexion, extension, and rotation fracture patterns. A compression fracture is a great example of a flexion fracture. This causes an anterior part of the vertebral column to break while the posterior part remains undamaged. This type of fracture is usually caused by osteoporosis, and it usually results in loss of height and a hunched back. Another type of flexion fracture is the axial burst fracture. This fracture is more severe because the vertebrae is fractured in multiple places. This can cause damage to the spinal cord when the broken pieces of the vertebrae spreads out. A type of extension fracture pattern is the flexion distraction fracture. This fracture is usually caused when there's a huge external force that is exerted to the body. For example, like a car crash. This will cause the vertebrae to be completely pulled apart. You can see there's a picture of an flexion distraction fracture right here. Now finally, we have the rotation fracture pattern. The first type of rotation fracture pattern is the transverse rotation fracture. This is caused by bending your body too much to the side. The other type of rotation fracture is the fracture dislocations. They occur when the vertebrae moves out of place, and this can easily damage the spinal cord. Here we have a picture of the fracture dislocations. A fractured lumbar vertebrae can affect these parts of the body: the vertebral column, the back muscles, the spinal cord, and ligaments and tendons of the back muscles. Now this is where we're going to use our biodigital human here. I've dissected this part so that you can see the skeleton here and you can see our back muscles here. The back muscles that could be affected by the fracture would be right here, the latissimus dorsi, and if we dissect that, we can see the other muscles such as the multifidus, which would be under this actually. Okay, let's get rid of that. Right here, the multifidus, and also the ligaments and tendons that connect these muscles to the vertebrae can easily be cut and damaged. Treatment to cure a fractured vertebrae includes drugs, therapy, and surgery. Non-steroidal anti-inflammatory drugs, also known as NSAID, in short, are used to reduce inflammation around the spine. Physical therapy is done to encourage strength in the areas that are affected by the fracture. Occupational therapy is done to aid the patient in learning to function normally after a spinal cord damage. Some fractures require a surgery to stabilize the spine. Metal rods and screws are used during the surgery to restore stability to the spine. Laminectomy is a surgery that involves removing any bone fragments that are applying pressure to the spinal cord. All patients that suffer from a spine fracture will have to wear a brace to keep their bodies upright. These surgeries can result in many complications, and so it must be carried out very carefully. Complications associated with the fracture can include the following: blood clots in the pelvis and leg, pulmonary embolism. This occurs when a blood clot breaks free and travels to the lungs, pneumonia, and pressure sores. Complications associated with the spinal surgery can include bleeding, infection, leakage of spinal fluid, instrument failure, no union, which is the failure of the bone healing, and paralysis of the lower body. The recovery process. A patient can take up to 8 to 12 weeks to recover depending on the type of fracture. The main objective for physiotherapy is to strengthen the transverse abdominal after a lumbar fracture. These are the recommended physiotherapy exercise for recovery: reverse curl-ups, hip bridging, oblique contractions, pelvis stabilization, and flexion and extension of the quadriceps. Thank you so much for watching, guys. I hope this video was helpful for any of you watching. This was my first ever webinar and I actually had a lot of fun making it. So here are my references, and yeah, have a nice day, guys.